We need to be looking at how we're going to live with COVID-19.
Alberta is forging ahead, announcing sweeping changes that end many quarantine and contact tracing requirements. By mid-August, it will no longer be mandatory to isolate if you test positive for the virus.
We did not employ those public health measures to manage cases. We employed them to reduce the chances that our healthcare system would be overwhelmed.
Hinshaw said Alberta's vaccination rate meant that risk is now lower, even as Albertans enjoy life without COVID restrictions.
I'm feeling just fine, but I know some people are concerned, and I'll try to respect that, but I'm feeling fine.
We did bring masks if it gets busier, but I'm feeling pretty confident. We've been double vaccinated, and it's just good to be out and seeing other people in Edmonton and celebrating with good food.
Alberta's aggressive reopening plan means for weeks crowds have filled patios, many going maskless at events like the Calgary Stampede. But there are signs the reopening is giving COVID-19 a chance to reemerge. Alberta's R value, representing how rapidly the virus is spreading, doubled in July, from 0.75 on July 1st before Alberta lifted its remaining restrictions to 1.48 by mid-month. That means on average, 100 people with the virus will spread it to 148 others. Alberta's vaccine progress shows signs of lagging, with just over 54% of the total population fully vaccinated, lower than the national average. Alberta's premier says he's not concerned.
We're confident that we can be open for summer and open for good.
Not everyone shares that confidence, especially as the province pares back its tools for tracking the pandemic.
If we don't have good contact tracing, we will simply see numbers go up, but we won't know where they're coming from. And it makes it really hard to have a focused response to address that.
And with a third of Albertans still unprotected, the concern is that the risk of climbing cases and even hospitalizations remains. Paige Parsons, CBC News, Edmonton.